start?
No.
Okay, my name is Jolene Neto, and I'm going to be demonstrating the IV push medication. So first, what you want to do is verify your doctor's order against the MAR. And when you gather your medication, you want to verify the medication is the right medication and that it can be administered as an IV push or as an injectable medication. And you want to verify again, the doctor's order against the MAR and the vial to make sure you're getting the right medication. So you're gonna go into the patient's room. You're gonna explain to the patient that you're gonna be administering pain medication. You're gonna verify on their band their name, date of birth, that you have the right patient, and you're gonna explain to the patient that you're gonna be giving them pain medications. You're gonna take a baseline set of vitals, pulse, respirations, blood pressure, and SpO2, as well as a pain level. Since this is a pain medication, that way you can verify their pain has decreased after administration. So once you verify all that, you're gonna clean your hands with hand sanitizer or wash your hands. You're gonna get your medications, so you have the fentanyl, and you're gonna get your IV flush. You're gonna verify that the site of the IV is no signs or symptom of infection, no phlebitis, no swelling, anything like that. You're gonna get your flush ready, so you're gonna get all the air out of your flush, and then you're gonna flush the line with just 2 ml of water. And that's gonna check for the patency. Before you flush, you're gonna withdraw for a blood return to make sure that the line's patent. And you're gonna flush with the 2 ml of normal saline. If for some reason this patient was hooked up to an IV that was non-compatible with the medication you're administering, you're gonna wanna administer 10 ml of the flush to clear the line of the prior medication. So you're gonna wanna pause the IV pump and clamp the IV line while you're administering, because it'll be 2 ports. So it'll be the IV port that's hooked up and then the medication port. So once we've done the 2 ml of a normal saline, you're gonna get your fentanyl medication. With the medication, you're gonna cleanse the port before the flush for 15 seconds and wait 1 minute, then do your flush. And then you cleanse the port again, wait for 15 seconds with alcohol, and then you're gonna administer the medication. So for the medication, when you administer it, you wanna make sure that you have the line is patent, which we already checked for. So you're gonna give half the medication slowly. You're gonna wait a minute. You're gonna give the other half of the medication. You're gonna wait another minute, and then you're gonna give the rest of the medication. At that time, you're still gonna need to wait a minute. So we're gonna disconnect the medication, cleanse the port with alcohol again for 15 seconds, let it dry. After the minute, you're gonna attach your normal saline flush, and you're gonna give 2 more ml of normal saline to clear the line, and then you can start your IV pump again and let it go. If it was a non-compatible medication, you would have to give the 10 ml prior, the medication, and the 10 ml after you start, after you give the medication, before you start the regular solution flowing again. If it was a central line, you're gonna wanna make sure that the caps are on tight, so that way the patient doesn't bleed out. You're gonna do the 10 ml of normal saline flush. You're gonna get, and the 10 ml of normal saline flush is gonna be a push pause, because you don't want to do it too fast. So you're gonna do a push pause for the 10 ml, and then you're gonna clean it again with the alcohol for 15 seconds, wait a minute. You're gonna give the medication. For the medication, you're gonna do the same thing, half, wait a minute, half, wait a minute, and half again. And then once you disconnect it, you're gonna clean it, and you're gonna administer another 10 cc's of normal saline on the push pause method. While you're doing that, the last half ml, you're gonna want to create pressure in the calf, the central venous line. So you're gonna want to push. While you're pushing the last half ml, you're gonna clamp the line to create the pressure. You wanna watch your patient for a minute after administration, and the medication will peak at 5 minutes. So you wanna come back in the room within 5 minutes and take another set of vitals and assess your patient's pain level again. And that's all for the IV push medication demonstration.